Welcome back, guys. I'm Nick from Active Chiropractic, and I'm going to show you a few corrective exercises for anterior pelvic tilt. Now, there's two types of pelvic tilts. There's posterior pelvic tilt, where the tilt goes backwards, and anterior pelvic tilt, where the tilt goes forward. Now, it's not just a simple pelvic tilt like so. Sometimes, most of the time actually, we have either one hip go forward and the other hip go backwards. Now that causes a lot of problems. So it causes things like low back pain, of course, and other pains in the buttock and like so. But it also can cause scoliosis. So scoliosis is the S-shaped spine. It can be corrected by a lot of professionals, for example, osteopaths and chiropractors as well. So it's best to actually see these professionals and get them sorted out, because most of the time these pelvic tilts aren't just caused by a malalignment in the hips. It can be caused by a lot of muscle dysfunction and other issues as well. It affects a lot of people as well. It affects athletes, elderly, children, and everyday people as well. The muscles that are actually responsible for an anterior hip are the hip flexors and the erector spinae, which is the lumbar extension muscles. So the deep hip flexors is known as iliopsoas, and the extension muscles are also known as erector spinae. We need to stretch these out to correct anterior hip. But we also should strengthen the muscles that do the exact opposite of the action. So something that creates this motion. So that's the buttock muscle, which is glute max, and hamstrings, and also the core, which pulls this up a little bit as well. Now be careful, when you do train your core, sometimes we tend to actually activate iliopsoas, which is the hip flexors. So there's certain exercises that you try to avoid to do. This cocktail of problems is also known as distal cross syndrome. So I definitely recommend you go see a professional such as a chiropractor and get yourself assessed and see what is the real problem. It might not be distal cross syndrome, it might be other issues, like for example, things that are happening up here that's causing anterior hip tilt. So the first stretch I'll be showing you is the iliopsoas stretch. So it's that deep hip flexor stretch. So what you do is you just go into a lunge position. Everything is about 90 degrees. So this joint over here is 90 degrees, this is over here 90 degrees, and this is 90 degrees. So what you do is you bend this knee forward, keep your bum nice and activated, and what you try to do is draw this hip joint forward like so, and bringing the hip joint forward, and it stretches the deep hip flexor around that area. Now if you want to target it a little bit more, place this hand here, same hand, same side that you're stretching, pull it over and reach over slightly, and remember, engage the glutes and push forward. And hold that for about 20 seconds to 30 seconds or 8 long breaths. And you do this 3 to 4 times. A great lower back stretch that you can do is go on your knees and reach as far as you can and hold it for 20 to 30 seconds and do it 3 to 4 times. Now this stretch can also decompress your lower back, so it actually stretches out and relieves a lot of pain and also a lot of pressure off the lower back as well. The next lower back stretch that you can do is just lie on your back and draw 2 knees towards your chest and hold it for 20 to 30 seconds or 8 long breaths. Now this stretch is really good because it decompresses a lot of pressure of your lower back and relieves a lot of pain. Check out my other videos as well, the best 4 lower back stretches, and it's really good, and it's a whole heap of other stretches that you can do. Now for the strengthening exercises. This is a simple exercise that you can help train your glutes and your hamstrings. Basically just lie on your back, put your hands on the floor, put your neck down, and these are called bridges. So do about 10 of these, hold it for 1 second, tense your glutes, tense your hamstrings, activate your core, and then release. And do about 10 times and relax. Rest for about a minute and do this 3 times. So I'm going to show you a core exercise. There's heaps of core exercises you can do on YouTube and Google, so I strongly recommend you go actually search them. But I'll show you a simple one that you can do at home. Now the most important thing you need to do is actually point your toes in this. This helps deactivate the deep hip flex muscles, so known as the psoas muscle. Lie on your back and point your toes. And then all you need to do is just lift up and down. And you do that about 10 to 20 reps, 3 sets. Guys, if you do have a hip problem, remember to go see a chiropractor and see a professional and actually get assessed properly and get it corrected properly. Now the exercises that I showed you are very easy exercises. So remember, if there's other harder exercises or more challenging exercises, I do promote you to actually try them out. So remember, stretch out the hip flexors, stretch out your lower back, train your buttock, which is the glute max muscles, and also strengthen hamstrings and core. Now, if you really want to support my channel, remember to hit like, give me a thumbs up, hit subscribe as well. And if you have any ideas or comments, remember to comment below and I'll try my best to respond to them. And I'll see you next week.